Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm pleased today to be talking with Dr. Wayne Jonas, a family physician who practices at Fort Belvoir in Maryland. He is director of the Samueli Integration Healthcare Programs, a organization that focuses on advancing whole person and integrative health. Dr. Jonas, thanks so much for joining with us.
Thank you very much, Larry. It's a great pleasure to be here.
So can you tell us about your background? Where did you go to medical school and where did you train as a resident?
Yeah, so I went to medical school at Wake Forest School of Medicine. Back then it was called Bowman Gray, now Wake Forest. And I did my family medicine residency training at Fort Belvoir. Actually, DeWitt Army Hospital, a community hospital that allowed for, pretty much comprehensive whole family care, both inpatient and outpatient. So got excellent training in there. And then I spent 20 years, my first 20 years in medicine, practicing in the military in various places around the world, doing, bread and butter family medicine. During that time, I then got interested in research, in trying to find out how healing works. And so I went to Walter Reed Army Institute of Research. I did research fellowship there, and then stayed there for a number of years, and then eventually took over and ran the research fellowship, training other clinicians in research. Then I was at NIH for a few years, running the Office of Alternative Medicine. And then finally, when I got out of the government, I worked for the Samueli Institute, a research group funded by Henry and Susan Samueli out in California. And now I work directly for the Samueli Foundation, looking at how do you deliver whole person integrative health in primary care and in other areas. So that's a little bit about my background. I still see patients actually at the Fort Belvoir Community Hospital in a large residency program looking at integrative pain management and whole person care there.
Thank you. So you've written a book, which I've had the pleasure of reading, How Healing Works. And it's a powerful read that, from my point of view, describes a healer's vision about what is possible in primary care. Can you share your perspective with the listeners?
I'd be happy to. I think the basic tenet of the book is something that I have learned over my 40 years of practice and research, and also exploring various healing traditions from around the world, is that most of health and healing does not come from the medical encounter or the medical visit or even from healthcare at all. In fact, this is now actually been looked at very closely by the National Academy of Medicine and other groups. And we now know that if everyone had full access to Cadillac level or platinum level health insurance and health coverage like the military folks that I take care of, it would only improve the population health of the country by about 20%. Only about 20% of health comes from healthcare. The other 80% comes from outside of what happens when the patient comes in and sees the doctor. It comes from their life space, it comes from the personal behavioral determinants, and it comes from the social determinants that they're engaged in. And yet, healthcare rarely reaches out and addresses those areas. So you end up, when you go in seeing the doctor, getting into a system that is spending a lot of money, and you're spending a lot of money on it, doing pills and procedures that don't really address the core determinants of health. And so this is the reason why our costs in that kind of a system in the U.S. Is one of the main culprits. Are double costs anywhere else in the world, that our outcomes by almost any measure are actually declining and getting worse over the last decades, why there's increased burnout as physicians continue to run on the treadmill doing things that are not producing health, even when they know it and the evidence shows it, and there's continued dissatisfaction within our healthcare system. And so I wrote the book to try to explain that healing actually comes, from a core set of things in the life space, and that if healthcare wants to get back into the business of creating health and healing, that it needs to restructure itself, to address those underlying determinants. And that's what the book is about. And I show not only the research around it to illustrate that, but actually try to show both patients and physicians how to do this in their practice today with a variety of tools and a variety of approaches that can bring healing-oriented healthcare back into healthcare delivery.
So many years ago, I had the pleasure of hearing Dr. Ian McWhinney, many considered to be one of the intellectual founders of family medicine, give a plenary presentation, and he talked about the importance of the placebo effect. And rather than saying the placebo effect is something on the side that's not important, he brought the placebo effect front and center and said that family physicians appreciate and need to understand the placebo effect and how to stimulate the placebo, the healing effect. You make a major point in your book about the placebo effect. Could you comment on that?
Yeah, absolutely. And Ian was a visionary way ahead of his time, and those comments were right on the mark. The term placebo was co-opted largely by regulatory groups in the pharmaceutical industry in order to distinguish between what they felt was no effect or an inert substance and an active thing, so that they could get and license their products. But we know that if you open up the hood and look underneath the veneer of what's called placebo as to what are the underlying factors that result in healing from what we call the placebo effect, you realize it is the core aspects of the ritual of clinical care that facilitates our own inherent healing capacity. And we now know that those components involve things like belief and expectation. They involve ritual and ritual interaction, which goes on in any healthcare encounter around the world, regardless of the system that you practice in. And then it involves social reinforcement and conditioning issues that go along with that. And if you put those three things together, then you have got the tools that can optimize the use of the so-called placebo effect and make any treatment that you're doing more effective and optimize healing. I don't actually like the term placebo. I wrote a editorial in the Annals of Internal Medicine with Dan Moorman many years ago and said, let's redefine the placebo as the meaning response. And I write in my book that this is at the heart of healing. If you can induce a meaning response where the patient, their social context, and their ritual all hits at these underlying components of what's so-called placebo effect, you can maximize healing to a great extent. Sorry for the background noise here. Let me turn that off.
Not a problem. So I'm aware that among the evidence-based folks, the idea of an annual visit is not something that is thought of very highly. In fact, it's considered pretty much to be a waste of time. But in your book, you talk about the Hope Note, and I'm wondering if in the new primary care, as we go forward, the idea of having an annual visit with your physician structured around the Hope Note might not, in fact, be a very productive use of time. Could you explain to people what the Hope Note is and comment on that idea?
Yes, be happy to, and I agree. If there was an annual visit that specifically did the Hope Note, and that I think it would be add tremendous value. So, everybody, all physicians and providers know about the SOAP note, and that's a subjective, objective assessment and plan, and that's where you come up with a diagnosis and your treatment for treating a disease. And that gets it to 20% that I was talking about before, and you have to do it. It's very important. If you've got a specific thing to treat, you don't want to miss it, right? And do that. But the vast majority of chronic disease is not addressed effectively that way, and it doesn't get at the other 80% that facilitates actual healing for chronic illness. And so the Hope Note stands for a healing-oriented practices and environments visit. And what it is, it's a set of questions, very much like you would do, if you were doing a diagnostic assessment, but the questions are focused on the underlying determinants of health. And so it orients the visit to looking at the physical environment in which the person lives, their behavior, such as sleep, nutrition, stress management, activity, their social and emotional components, the social, support that they have, the sense of family and belongingness that they have, which are crucial to health and healing in chronic disease, and most importantly, to the mental and the spiritual components. The question gets at what really matters to the person in their life, not just what's the matter with them in that particular moment. And so by asking what matters and getting at those reasons that the individual lives, why they're alive, what motivates them to get up and do what they do every morning, and hooking that up to those underlying determinants of healing, it reframes the conversation to really be whole person and get at that 80%. And I think if we did that, we would not only be able to actually return healing to healthcare practice, and I do this, I teach this in the residency where I practice, and with medical students. If we did this, we would not only actually get at the underlying determinants of health and healing, but we would also reestablish a relationship and a partnership with the patient, where they now feel like that we're partners on their healing journey. And we know in family medicine especially that kind of trust and relationship is the glue to optimal outcomes, and it's also the antidote to burnout. We reestablish that relationship. Almost all family physicians say, what do you miss? Why are you getting burnt out? It's because I'm on a documentation treadmill that doesn't allow me to really get to know the patient. And the Hope Note allows that to happen.
So you're coming to the 2018 FMEC annual meeting this fall as a plenary speaker. What impact would you like to have?
Well, I hope that the physicians coming there can get inspired to sort of re-envision whole person care in their practices and actually go beyond that, take charge and change their practice so that it becomes healing oriented. I'm going to try to talk about why this is important, why we need to do it as primary care physicians. We're going to look at a number of models as to how it's actually happening out there in practice through lifestyle medicine and integrative health practices. And then, we're going to provide tools for them, things like the Hope Note that I just described, on actually how to do this. So I hope when they come away from that conference, they're prepped and ready to go to begin to make those changes in their day-to-day practice.
Awesome. So in our past conversations, you've shared with me your goal for the next stage of your career. Could you share that with our listeners?
Well, yeah, my hope is that I can have some influence on a transformation in healthcare to a healing-oriented system that does routinely focus on what matters and the whole person, that pulls together integrated teams of care that provide and deliver that kind of meaningful healing-oriented medicine, and that the physician can be, at the center of I think what most primary care docs went into medicine for, really facilitating healing. I would say, if before I leave this world, we see every encounter that asks what matters to you when a person has a chronic disease, and that occurs within practice, then I would have accomplished my next phase.
And just to let the listeners know, there's a group of us that are planning to support Dr. Jonas's dream, and our goal is to create a tipping point to move away from a production-oriented delivery system to a healing-oriented delivery system. And so I hope that folks will come join us and get involved in the movement that will lead to this tipping point. Dr. Jonas, I want to thank you very much for joining with us today, and I'm looking forward to working with you not only at the annual meeting, but beyond as this movement grows. And we take back the night so that America has a better healthcare, a healing healthcare system.
Well, that's wonderful, Larry, and thank you so much for your leadership in sort of driving this movement and bringing together so many different visionaries to advance that cause.
Great. Thank you very much.
Okay. Take care.